Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay, so this is turned in from a half an hour.
Continue.
Right, it turned in from a half an hour with, of course, Nicole Andrews, and she is the registered dietitian, but she likes to be called a nutritionist because that's what she wants. She doesn't want to talk about
we
diets.
can call her the food specialist.
I don't like the word diet.
The guru.
Yeah.
Let's name her a food
Diet,
guru.
diet is a 4-letter word.
No, it's a
can you be the
beautiful
guru?
word.
I like the term functional nutrition and lifestyle therapist. I think
Yeah, that's right. That's what we're listing you as. That's right.
Ooh,
It's about
I
function.
like that one.
It's about function,
Okay.
and
So-
lifestyle.
Lifestyle therapy.
Functional nutrition and lifestyle therapy.
That's those are the names. Spring cleaning. That's what you said. You're gonna write the article in April, and we're calling it spring cleaning, right?
Right. That's like we were talking about. There's so many different. There's different things you could do. You could do a cold pressed organic juice fast, and that's not a detox; it's a fast. But to do a detox, it's great to do, like I said, 2 to 4 times a year, and with a professional, with a pharmaceutical grade nutrient
And the way
company.
we do it at AGI, you
At
have a
AG
whole team.
And yeah, I was going to say, it's so important, especially if you're on medication, to be followed by your doctor, because what happens with the detoxification nutrients is that they upregulate the liver. They upregulate phase 1, phase 2 detoxification. So what does that mean? It means that even your medication is going to be metabolized quicker. And so you have to be followed by your doctor. Maybe he would want you to come in and do more, take more blood pressure readings, or
Check the
or
sugar
check your
more
sugar
frequent,
more
check the
frequently,
thyroid.
and your energy low, and just to follow you maybe much more closely. So that's the benefit too, is that, you have to be, so, you want to be followed.
And before God put you in my path, to help our path to help our patients and clients that you bring to the center. Basically, the match was the dietitian will be someplace in the community, and the doctor will never hear about what the dietitian was recommending. And some people, some doctors don't even believe in that. So they believe I will only call a dietitian if you are already a full-blown diabetic. Mm-hmm. And that is so wrong, because a lot of my patients with pre-diabetes, they work so closely with Nicole and Courtney, and they do so well. I had a patient that came all the way from Wellington, and he came all the way from Wellington to Fort Lauderdale to see me. And he need dietary follow-up. And he was so happy to say, I can go to the Boynton office then and just go and see Courtney over there. And I told them, you can do the initial consultation with Nicole, or you can do it with Courtney, whatever you want. And
So you have 2. We didn't even say that.
Right.
That's how much you think of this.
Right. So, I think it's so valuable to have a dietitian working with us and helping us do more of a comprehensive, because when it comes to prevention, we talk about spring cleaning. If you have a house and you have leaves on the in front of your house, you can rake the leaf and pick them up. Did you really clean your house? Did you go into the closet? Did you organize your closet? Right. When it comes to cleansing your body, some people think to do a detox, if I just cleanse my intestine, I'm done. What about the mitochondria?
Exactly.
How deep do you go into your system to cleanse yourself? And
you want to clean my whole closet, don't you?
The whole house.
Exactly.
Boy,
The whole house.
We can't piecemeal the cleaning. You have to do the whole
He always
thing.
does this. He always takes things in an everyday matter, and that's how he talks.
Yeah, because I think that's how the patient will understand that Because, when Nicole tell them, we're going to put you on a cleansing program, and it's going to be 2 weeks. Well, those 2 weeks, I usually have an open door policy for the patient. If you have any concern, anything you're checking your sugar and it's dropping too much, or your blood pressure is getting too low, or you start feeling dizzy, come in and let me check you. And and that way they don't fall off the wagon. They continue to follow Nicole's recommendation. And, when you go to cleansing, it's like if you are an alcoholic and you drink 3 or 4 bottles of wine regularly and suddenly you stop, you're going to go through withdrawal. When you eat the wrong food and you're going to stop doing that for 2 weeks, 3 weeks, and see how your body reacts, you're going to go through withdrawal.
Exactly.
Just a different type of withdrawal, but you're going through withdrawal in your body.
That's so important to prepare and wean yourself slowly so you don't, end up feeling horrible and then just kind of putting it to the side and saying, well, I'm not going to do that. I feel this is too much for me, and people will do that. But if you introduce it slowly, you're slowly preparing, you're weaning down. If Dr. Mencia said, if you drink, 4 drinks a day, then you go down to 3, then you go down to 2. It's the same thing with coffee. You wean yourself off. And the same thing with gluten. If you're eating, 10 slices of bread a day or whatever it is that you're eating, you slowly wean yourself down off of that. And the same thing because, and even dairy, if you're having a lot of milk and cheese and cottage cheese and Greek yogurt, gluten and dairy are some things that do affect our brain as well. And they can cause inflammation of the brain and cause gluteo or casomorphins. It's actually why people are so drawn to those foods, because it does create this feeling of euphoria a little bit on a slight level, but they don't realize they're addicted to them and it's creating this in their brain. But when they stop drastically, they could feel horrible. So that's why it's so important to go slowly, and so that doesn't happen and they don't just lose heart and just start eating their normal diet again.
Well, on television, we notice now the advertising for, and I won't mention it, there's this one company, you buy all their food and you're going to lose. The guys say, I've lost 50 pounds in 2 months and look at me now. And that's the problem, isn't that? People, maybe they get on that kind of a program, but it can't possibly last.
No, and that's the difference between diets and lifestyle change, because people sometimes don't lose any weight from maybe 2 weeks, but because we monitor their body composition and not just their weight on the scale, I might be able to say, oh, you know what? You lost 1% of body fat. And even though the scale weight didn't change, your body composition is improving in a way that's a healthy way of weight loss. So, the number can be so deceiving for people, and that's why we have body composition machines. So we can measure the healthy rate of weight loss, because when people lose weight, it's not all created equally. It's if they lose metabolically active tissue, their metabolism's going to slow down, which is, their lean body mass, and their blood will not be as clean, or, they won't have the optimal changes in cholesterol and blood sugar, versus if they preserve their muscle mass and lost weight, but they preserved their muscle mass and lost the body fat.
I have three people that come to mind from that work at the office, and one of them that spoke with me this week was Patricia. She said, I've been following with Nicole and I'm losing weight, but I plateau. Should I do anything differently? And I say, no, that's good. Now what your body is doing is readjusting, because you're losing fat around your heart. The liver is cleansing. All of these things taking place, and it's not at the speed that you want to, it's at the speed that your body can take. So she understood, and she said, oh, okay, she got all motivated. Okay, I'm going to continue that.
Good advice.
Right, because a lot of people come off of a diet because they lose, let's say, 8 pounds or 12 pounds, and then they plateau, And they say, oh, this is no good.
You're
I'm not losing
frustrated.
any more weight. And if you continue, then you see that you will drop back again.
Right.
And the other one was Ina, that yesterday she's walking around. And you see Ina, she's very energetic and she does
had
so
what I had,
much.
right? We were sick.
So, well, yesterday she was, I feel so lightheaded. I don't know. Could you check my blood pressure? I said, sure. So I put her in one other room and her blood pressure was low.
Mm-hmm.
So I said, well, with your diet, what you're doing, we're going to do a little bit of salt and put salt in water and you're going to drink it to replace the salt.
Electrolytes, yeah.
Yeah, just to adjust your electrolytes and continue with your diet. And she did that, and she went back, went to the bank, did this, and I saw her functioning and doing all her stuff.
Mm-hmm.
So I have a big question for you. You notice that, and I haven't noticed as much on women, but I'm sure it's there. Men, as they reach 50, 60, they wind up with a stomach. And even thin men, they have the stomach. What is the stomach? What is causing that to be like that?
Different thing can do the stomach. In women, if they have kids, usually when a woman is pregnant, they will accumulate fat underneath the belly button. And that fat is there to protect the baby. Or babies, like Tina.
Right.
And so that fat is hard to come off. And in a woman, it will protrude as a little belly. And sometime in the office, what we do when just do mesotherapy and we can melt that fat. Some people do laser or other thing or tummy tuck. But you can do non-invasively without major surgery. We can do mesotherapy and get rid of that. In men and women, they can have a little belly that could be your spine. If you have osteoporosis and you are losing height on your spine, because you are losing height, the intestine size have not changed. So they have to find a way to go. They cannot go up because you have your lung and your heart in your chest. So there's nowhere to go up there. If a woman has a hysterectomy, you have created some more room at the bottom. But if a woman have not had a hysterectomy, usually the uterus will shrink, and if the bladder is full, then the belly will pop out. That's why some patients, they say, oh, my belly popped up when sometime, and then sometimes it's not there.
Right.
And I usually ask them, well, how are you urinating? So in a man, if they have prostate issues, they have problem emptying their bladder. And a lot of young men, unfortunately, in their 40s, they think that, this is not me because I'm so young. It can be anybody. You can have not necessarily prostate cancer, just a enlarged prostate, what we call BPH. Right. It can affect your sex performance and the emptying of your bladder. So there are many organic things that can be going on that will make a man beside fat. And one of the ways that you know about fat, how much fat you have in front of your belly, you go to your love handles, which is if you follow your ribs and go down from your rib, there's one portion that's going to stop you.
Yeah,
and
they're pretty easy to find.
And if you find your love handle, right, if those love handles are big, that means you have a lot of fat in front of your muscle.
In front as well.
As well. On the side, it just drop here to what we call the love handle. But in the front, it distributes evenly in front of you.
More space to stretch it out.
More space. And then you want to know also, do you have irritable bowel syndrome? Because people tend to bloat, and by bloating in the guts, that will also present like a big belly.
Big belly, sure.
And, then you have the beer belly.
The apple shape.
Right. So, it always go back to the diet. And a lot of time when I send my patient to Nicole to work with them, I say, well, I used to say at the beginning, I'm going to send you for a dietary consult with Nicole. I want her to work with you. Now I don't say that. I want Nicole to be your coach with your diet. And to be your coach means that you're not going to go once and disappear from her. I want you to really follow up with her and let her know, out of your recommendation, I was able to do A and B. The rest of the 7 recommendations I have not been able to follow. And a lot of times, just like I do with my patient when they have pre-diabetes, and they say, I still doing the bread, Dr. Mencia. I said, that's okay. At least we got the fruits and we have the pasta out of the way, or you have decreased the pasta by 50%. So you had done, so I become a coach in the room, but I don't have the time she has.
Yeah.
I have to worry about the entire you. And she does also, but more in her specialty. So, I usually tell my patient about.
And that's so nice because you don't usually have that, with a lot of people that come to me from outside. Their doctor spends like 5 seconds with them and they don't talk about nutrition, or they don't, they don't value the importance of it like Dr. Mencia really does. It's so important. It's such a nice thing to be able to, offer people, so that, especially you have those people that would like to try to change their diet, change their lab values and first. And he's very open. Like, why don't you work with, Nicole, so that you can see how this works naturally. And if you change your diet, he doesn't quick to put you on medication right away. And it's such a beautiful thing to be able to have that option. Because I think, so many are very quick to write anything, but,
the patient now, they are so in tune of what they are looking for, and they research. They research you, they research me, and it was funny. Oscar and I and one of my students, we saw a new patient this week, a young kid, and he wanted to get a full examination. I said, I want to do a full yearly exam, and I have a good insurance, so you can highly recommend it. And I came to see you because I can see you walk the talk. You are into sport and you are healthy. So I want a doctor like that. And, if you go to a doctor that is unhealthy, that smokes and eat the wrong food, and they come into the room eating French fry or
they don't look healthy.
They don't look healthy. So, it's hard to tell a patient, well, I'm telling you to be healthy because I'm a doctor. Right. I think that's gone. That's gone with the wind.
Right. Because people do what you do. I mean, that's part of why I got in the field that I got into, because I remember thinking if I say something, I say it because I mean it and I do it myself and I really believe in it. And I thought, what a great field to get into, to hold myself accountable and to not get myself so, unhealthy, and it would keep me on track and in line myself. Because I can't see it any other way. Like, if I'm going to say something, I say it because I do it, or I live it, but that's the follow-up, which Dr. Mencia mentioned, is so important for people to understand too, because so many people think just that, they're going to go in and see somebody just one time and get all the information. And while we do talk about a lot of information on the first visit, it's a lot of information because it's the only time we have a whole hour. But I never expect people to go right away. I mean, I would be worried if someone did every single thing the very next day, because it's hard to keep that up if you're not, if you're making too many changes at once. So say, even if you could just make 2 or 3 of these things that we talked about, that's great. And then, come back, and it's in their own schedule, so it's like, even if you want to come in every 2 weeks in the beginning, and then I have people that come in and check in once a month, and they love it. And they love just being accountable.
Exactly.
To have someone to follow them. Like, once a month, I have to check in with my nutritionist or dietitian, whatever you want to call it, my coach.
Dietitian,
and
my coach.
And that is, so
I got to give some information. Everybody, I think, is really getting ready for spring cleaning. And we're going to really get them to you.
Let's start cleaning our own body.
Right. We're all going to do this.
I'm doing it.
This is how you're going to do it. If you live in the Broward County or the Miami-Dade area, you'll want to go to their Commercial Boulevard Center, and that's at 1608 East Commercial Boulevard. It's called AGI Medical and Dental Centers. The phone number there to make an appointment, you will have to make an appointment to see Nicole because she is very busy, but they're very good about that. 954-489-1345. Now, if you live in the North Palm Beach area, the middle of West Palm, Boca, if you prefer, you want to go to their Boynton Beach office, you can go at 561-270-6494. Because Courtney is also a nutritionist and a dietitian, and she can help you there. You can probably switch off. They probably do the same thing in both places, so you can decide. You can be with Nicole or you can be with Courtney. But remember, they really want you to do spring cleaning, and I think that's what we're all going to do. So please go there. Now, also, home visit services are available, not for nutrition, but for homebound people who've had strokes, they can't get out. You need someone to take care of you at home. They're one of the very few medical organizations and dental that will come to your home.
Right.
And it's really special about that. So
that is.
I love the fact that you do that. Now, their website is agifl.com. So, okay, so now I did all the stay healthy and vital stuff. Now we can go back to, remember, you'll want to come to the Cure Symposium on April the 9th.
Let's talk about
because
that.
We want Dr. Mencia will be there.
We're both going to be there.
He's such a charmer. People said, I mean, you know, because I try not to have same people each time, but we had to have Dr. Mencia. And of course, Nicole, we're going to do this exciting way of analyzing the food. You'll show it to them. You'll tell them what's good, what's bad.
For the people that joined for the Wonderful World of Wellness program, can you tell a little bit of what you're going to be doing at the Cure Symposium?
So the Cure Symposium is a different topic this time. Last time, we talked about the SpectraCell micronutrient test, but this time it's your diet, it's your overall diet, and how healthy is your diet and everyday foods that may be making or breaking your diet and your overall health. So there's so many things that people eat on a daily basis that have whether it's sugar, the different fats, different ingredients. I'm going to have a lot of products on the table, and we're going to be talking about 3 specific categories. Sugar, which is, world's biggest legalized drug, because it's so addicting, sugar, and how we get sugar in our body, how we get it and how it builds up, and the harmful effects of sugar and what it does to our body.
And you don't need a prescription for it.
You don't need a prescription. That's the best part. And then about how, what's in the box and the bag and the processed foods that's hurting you. Everything from, high fructose corn syrup to empty calorie foods, and we'll go through some products and some everyday foods and then show you some better alternatives that are out there. And also fats, because fat has gotten a bad rap. It's not a bad food. There are lots of healthy fats and
we are
unhealthy
not all
ones.
Bad people.
And unhealthy.
We are not all bad people.
No.
There are some of us that are good.
That's right. Because there's a lot of healthy things. There's good fats out there, and there's bad ones to be aware of, and they're not the ones that you probably think, And so nutrition is constantly changing, and you have to be up on the latest research. And what we recommended in 1980 is not the same as what we recommend today, because it's constantly changing, and you have to constantly be learning about what's new, not from the news, because that can be very confusing as well, and it will stray a lot of people, but from real nutrition professionals.
I know Dr. Mencia is going to love this because he grew up in Hawaii.
Right.
Living in Miami, as I was telling you, it was very common for us to get coconuts. They fell to the ground. And we took a hammer, and we took whatever we had to do to open it up. And we'd get, of course, that wonderful coconut inside. And then we'd poke the 3 holes, and we'd drink the juice. Mm-hmm. And then we'd break it open, and we'd eat the meat in the coconut. Mm-hmm. Now,
yummy.
And I mean, and now we find out that that's one of the healthiest foods you can have, and yet but now we do. But before they said, it's fattening, it's this, 1980s, it's that, do it exactly.
Right.
But now I only use coconut oil for my cooking. But I should get coconut juice. But should I be getting the coconuts that you can buy and eat it fresh from that?
Well, I mean, the thing with coconuts and why they got a bad rap way back when was because it is a saturated fat. And saturated fats are in meat and butter and things like that, and coconut. But it's there's different types of saturated fats, and we'll talk more about that at this Cure. But the thing of it is that that's important is it's the kind of saturated fat that's protective. It has antimicrobial effects, antibacterial effects. So it's a healthy saturated fat, and there is such a thing. So it's good to eat. It's good to eat. It's good to drink now the coconut water. That can be misleading too, because a lot of
there's sugar in it.
We had a patient recently that was drinking a lot of coconut water, and why is my sugar in the 300s? And we went through, and even Dr. Mencia called me in the room, and I said, well, what do you, I don't eat sugar, I don't eat bread, what are you drinking? Like, I've just been drinking a lot of coconut water. And I said, where do you get your coconut water? And because a lot of coconut water, if you look on the label, is loaded with sugar, because there's different manufacturers of coconut water.
And you get coconut water without any sugar?
You can get one with the lowest sugar. I think the lowest one I've seen is like 7 grams.
How about the coconut water from the tree?
Yeah, what about that?
Perfect.
We should be getting coconuts. Maybe you have to start selling coconuts at
selling coconut at AGI. We can call it AGI coconuts.
No, listen. You can have a whole basket. You can have a whole basket of coconuts. And maybe you give one.
Next venture.
Take all my trees. Take all my trees down. I want to plant coconut tree now.
That's right.
We're replacing the supplement case with coconut.
Well, when we had our house, all these men would come and they wanted all the coconuts. Because before hurricane.
In Hawaii,
and that's what they were doing.
The neighbor used to say, young boy, will you please pick up some of the coconut? Sure, we grab the coconut together.
That's it. And so,
what about coconut coffee?
Coconut coffee.
Yeah, there's coconut milk
I've never
coffee.
Heard that.
Mm-hmm. Yeah. There's coconut creamer, too. Yeah. Coconut cream. Well, it's a dairy alternative.
Not to promote anybody, but I was traveling to Orlando to lecture, and I went by one of the vendors there, and they didn't have soy milk. So I can have a soy milk latte. And they said, we don't have soy milk, but we have coconut milk. And I said, oh, let me try it.
And it wasn't the coconut milk? Oh, no,
it tasted differently, different, but it wasn't bad.
That's why I put it in my smoothie every morning, the unsweetened coconut milk.
Well, that's what we're going to talk about. I am so excited about this. I think, now you're going to write the April article.
Sure am.
We'll get your picture in there. And we have our next guest who's just calling in. But I have to tell you, this is a wonderful thing, and I'm going to be your prime suspect.
Yay!
I am going to do it. I'm going to get, now, I keep thinking about getting thin. I'm going to get as healthy as I can, and I am really going to do this.
And losing weight will be a side effect.
Yeah, very excited. Everybody's going to come to Cure to hear you and Dr. Mencia, but thank you so much for being here this morning.
And losing weight is going to be a backy fest, not side
that's right.
Because we're going to leave it behind.
That's right. Yeah. That's right. I'm so thrilled about this. It's funny that you were brought on.
Bye.
And we will get back to you when we see you. Thank you for doing all this. And we're going to take a break, and we're going to then
we'll see you at the Cure Symposium.
Right back.
Yes.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.